We have Ishika here with us. And, I really cannot overstate the importance of groups like Querencia, of collectives that have actually taken the initiative to rectify any sort of gaps in their own, curriculum. And I'm not even going to say anything more. I really want Ishika to just sort of like launch into what she has to say, because the perspective of a student and a future professional, I think, would be invaluable to everybody. So, Ishika, please take it away.
Thank you so much. I feel like all of the speakers which have they've covered so many important aspects, and the descriptions of gender dysphoria that we've heard today. I think all of the students here are really they have some great clarity now on so many aspects which, like mentioned, are not taught to us in medical curriculum. And obviously, if we are not taught about it, then it makes it even harder to get it into practice, despite all of the individual efforts that we might make. So what I want to mention here is that all the young medical professionals who are here or otherwise, they are absolutely eager to learn, to understand everything about gender identity expression. But the first thing we're taught in clinical exposure is history taking, and the first thing we say is demographic details, and one of the things we have to take is gender. And with we are actually not equipped till now. What we have been doing, we look at the person and we just assume their gender and write it down in our notebooks. However, it's this sort of conversation, since it's never happened before, and that's why we are not actually sensitive enough to go ahead and ask them for their pronouns and the gender that they identify with or want to express as. So I think this is the first point as a medical student where we just get stuck at, if we are aware about the web of gender. So I want to move on to talk about the medical curriculum. Like it was mentioned by Dr. Ren Messi, that we have so much to learn, and it's not just trans related procedures or interventions that have to come in. I apologize for any mistake that I might have made, since I'm also trying my best to get into this. But there are something as common as, say, UTI or diarrhea, like mentioned by Dr. Bittu, can actually make a student feel that, okay, I'm not sure how to proceed with this if I'm not sure how to address the person and ask them about their symptoms. So this actually is, we actually hoped that with the competency based medical curriculum which came in 2018, there would be significant changes. They incorporated ethics, medical ethics into it, but this is an essential component without which we will not be able to call ourselves gender inclusive healthcare providers, or ultimately not make an inclusive society. um, for all of this learning, it's very essential that we have dynamic role models who guide us, who we look up to, because without actually seeing it in practical life, it would make us very difficult for us to implement it ourselves when we actually go out as doctors. And the cherry on top is that our medical curriculum still focuses on it still considers gender dysphoria as a disease, as a disorder, which it is not, which we've discussed at length here. So I think in the chat box as well, it's mentioned how psychiatry as a subject is not is still teaching students how gender identity disorder is one of the disorders, behavioral disorders, which exists. At the same time, we talked about pediatrics, how from the beginning itself it's important for the child, for the parents as well as the child, to be given the freedom to understand and choose the gender that they wish to express. But as a child, we just the pediatrician just speaks of ambiguous genitalia or speaks of precocious puberty, but we don't go ahead and explain to the parents in detail that there is a possible, the child may not affirm to this gender. Therefore, we have to let them decide on their own as they grow up. And I think this is one of the most important aspects. At the same time, forensic, I'm sure all the medical students here know about forensic medicine and how it talks about sodomy, lesbianism, as sexual offenses, transvestism, as sexual perversion. And this obviously needs to be changed. This, after all that we've gone through, after all that's been done on the legal and social aspect, we need to incorporate it into the education system, like mentioned, from the primary education to professional courses. So I think this is one of the major aspects related to medical education, and as a medical student, that I feel most of us agree with. And yes, that is from my side.
Thank you so much, Ishika. No, that is invaluable input. And
Yeah, can I ask one question to Ishika?
Oh, absolutely. I mean, so we are taking Q&A at the end of this.
It is very much related to it.
Oh, no, then absolutely. Please go ahead. Please go ahead.
Yeah, Ishika, you spoke very well, but what do you expect from your teachers about this subject?
So like this, thank you for that question. I first of all I want to express my gratitude to all of the professors and the faculty who've joined in for this webinar and who are willing to learn along with us. And I think that is the first step that we're looking at from our teachers, because if I talk about in terms of say pediatrics, our teachers teach us about breastfeeding, for example. And since they have so much experience with it, since they've studied it extensively, they are able to give us the best inputs, both theoretically as well as practically. And I think the same principle applies here. If our teachers, our professors are aware about this in theory as well as in practice, then they would obviously be able to help us and help us navigate through this world, and as a doctor as well as an individual, because definitely what we learn from our teachers, our guides, is what we implement in our lives. So I think that is one of the biggest things we expect from our professors.